Okay, think about this. Your body has these two amazing master filters, your kidneys. They're working nonstop, 24/7, just cleaning your blood. But what happens if they suddenly just stop? Today, we're diving deep into something called acute kidney injury, or AKI for short. It's a really serious condition, and understanding it is absolutely key.
So, when I say a sudden shutdown, what does that actually mean? We're not talking about a slow, gradual decline over years. The most important word here really is acute.
So, what exactly is AKI? Well, it's a rapid, and I mean rapid, loss of kidney function. We're talking about a massive change that can literally happen in a matter of hours, or maybe a few days. It's this incredible speed that makes it so dangerous and sets it apart from other kidney problems.
And get this isn't some rare, obscure condition. AKI complicates nearly a third, 30% of all admissions to the intensive care unit. You know, it makes sense when you think about it. Really severe illnesses, the powerful drugs they use in the ICU, it all puts a huge amount of stress on the kidneys. It's a major, major challenge for doctors every single day.
Now, to really get a handle on AKI, we have to put it on a timeline. Because in medicine, timing is just everything. Not all kidney issues are the same, and the biggest difference usually comes down to how long they've been going on.
Let's just start with a super simple comparison here. On one side, you've got AKI, which pops up in less than a week. Then, on the complete other end of the spectrum, you have chronic kidney disease, or CKD. That's defined by problems that stick around for more than 3 months. It's really like a sprint versus a marathon.
Okay, so let's fill in the middle part of that story. Right between the sprint of AKI and the marathon of CKD, there's this middle ground called acute kidney disease, or AKD. The main differences here are the duration and some specific lab numbers. Doctors are looking at serum creatinine, that's a waste product in your blood that healthy kidneys are supposed to clear out, and the GFR, which is basically a score for how well the kidneys are filtering. As you can see, the longer the problem lasts and the worse these numbers look, the more serious the diagnosis gets.
Right, so once we know a patient has AKI, the very next question is, why? What's causing it? To figure that out, it actually helps to think like a plumber. Is the problem with the pipes leading to the filter? Is it a problem inside the filter itself? Or is there a clog in the pipes leading away?
And this chart breaks it down pretty clearly. A whopping 60% of the time, the cause is what we call prerenal. That's an issue with blood flow to the kidneys. Then, 35% is intrarenal, which means direct damage to the kidney tissue itself. And that tiny little slice, just 5%, is postrenal, which is a blockage after the kidneys.
Let's tackle the biggest one first, prerenal issues. This entire category is about one thing, blood flow. If the body's fluid volume is low, say from bad dehydration or bleeding, or if the heart just isn't pumping hard enough, the kidneys simply don't get enough blood. They're basically being starved of the very stuff they're supposed to be cleaning.
Even really common drugs can cause this. Think of the kidney's filter. It needs good pressure to work, right? Well, common anti-inflammatories, stuff like NSAIDs, can actually tighten up the blood vessel that brings blood in. That lowers the pressure and slows the whole filtration process way down. And on the flip side, you have a different class of drugs, really common blood pressure meds called ACE inhibitors, and they do the exact opposite. They open up the vessel that carries blood out, but the result is the same. The pressure inside that filter just plummets and filtration pretty much grinds to a halt. It's an incredibly delicate balancing act. All right, next up is our second category, intrarenal damage. This is when the kidney tissue itself gets hurt. It can happen from a severe lack of oxygen, that's called ischemia, or from being exposed directly to toxins. And we're talking about things like the contrast dye used in some medical scans, or even more dangerous stuff like ethylene glycol, which you find in antifreeze. And finally, we've got the least common cause, postrenal AKI. This one is probably the easiest one to picture. It's literally a clog in the drain. Something is blocking the urinary tract, causing urine to back up, and all that pressure ends up damaging the kidneys from the back end. So once the doctor has identified AKI and has a good idea of what's causing it, they need a way to measure how severe it is. They have to ask, just how bad is the damage right now? And this is where staging comes into play. This is the internationally accepted way to stage AKI. Think of it like a ladder of severity. Stage 1 is a pretty moderate rise in that waste product, creatinine, or a noticeable drop in urine output. As you climb to stages 2 and 3, the numbers just get worse.
creatinine goes higher, and the person makes even less urine for longer. Stage 3 is the most severe, and often at this point, the person needs dialysis, which is also called renal replacement therapy, to basically have a machine do the kidney's job for them. So we've covered what AKI is, what causes it, and how to stage it. But honestly, the biggest challenge of all is catching it early. So let's take a look at where the science is headed.
This quote just nails the problem perfectly. By the time a person's creatinine levels go up, the kidney has already been injured. It's like the fire alarm finally going off when the room is already full of flames. So the holy grail, what everyone is searching for, is a way to detect the smoke.
And this is where all the hope is right now, a new class of things called biomarkers. These are specific little proteins that the kidney cells release when they're under stress, way before they actually start to fail. So finding these markers, things like KIM1 and NGL, in the blood or urine, it's the molecular equivalent of smelling smoke. It gives doctors a chance to jump in and put out the fire before it really takes hold. And that kind of brings us to our final thought here. With all these new tools just over the horizon, you have to wonder, could a simple blood test or urine test one day let us predict and maybe even prevent kidney failure altogether? Could we stop this sudden shutdown before it even has a chance to begin? The future of kidney health might just depend on the answer to that question.